Hello, welcome to Physiotherapy Question and Answer Exam Special Series. Here we will be discussing common MCQs for each and every competitive exams like DHA, HAAD, MOH, Prometrics and National Physiotherapy competitive exams. Now let's move to our first question. Which of the following does the Golgi tendon organ dictate? Option A, muscle tension. Option B, dynamic muscle length. Option C, static muscle length. Option D, muscle action. And the answer is option A, muscle tension. Now let's move to our second question. Dash order lever is the lever of speed. Option A, first order lever. Option B, second order lever. Option C, third order lever. Option D, all. And the answer is option C, third order lever. Now let's move to our third question. TENS is a option A, microcurrent. Option B, low frequency type of current. Option C, medium frequency type of current. Option D, high frequency type of current. And the answer is option B, low frequency type of current. Now let's move to our fourth question. Which muscle steadies the clavicle during the movement of shoulder? Option A, pectoralis major. Option B, latissimus dorsi. Option C, subclavius. Option D, serratus anterior. And the answer is option C, subclavius. Moving to our fifth question. Thomas knee flexion test is used to dictate. Option A, lumbar lordosis. Option B, shoulder stability. Option C, hip flexion deformity. Option D, knee flexion deformity. And the answer is option C, hip flexion deformity. Moving to our sixth question. Pronation and supination take place on dash. Option A, sagittal plane and frontal axis. Option B, frontal plane and sagittal axis. Option C, transverse plane and vertical axis. Option D, coronal plane and horizontal axis. And the answer is option C, transverse plane and vertical axis. Moving to our seventh question. Green stick fracture is seen in option A, adult. Option B, children. Option C, at any age. Option D, elderly. And the answer is option B, children. Moving to our eighth question. Anatomical dead space measured by option A, Boller's method. Option B, Zion dilution technique. Option C, spirometry. Option D, single breath nitrogen test. And the answer is option D, single breath nitrogen test. Moving to ninth question. Most common cause of intertrochanteric fracture in old is option A, osteoporosis. Option B, burst disease. Option C, osteopetrosis. Option D, osteomalacia. And the answer is option A, osteoporosis. Moving to our 10th question. Cardiac output is the product of dash and dash. Option A, HR and diastolic pressure. Option B, HR and heart stroke volume. Option C, HR and EF. Option D, diastolic and systolic pressure. And the answer is option B, heart rate and stroke volume. Moving to our 11th question. End feel of dash is bony. Option A, knee extension. Option B, elbow extension. Option C, angle dorsiflexion. Option D, forearm supination. And the answer is option B, elbow extension. Moving to our 12th question. The severity of mitral stenosis can be judged by option A, intensity of murmur. Option B, duration of the murmur. Option C, left ventricular S3. Option D, loud S1. And the answer is option B, duration of murmur. Moving to our 13th question. Scaphoid fracture at wrist with retrograde bed subplay. Which segment is most susceptible to avascular necrosis? Option A, proximal. Option B, distal. Option C, middle. Option D, scaphoid tubercle. And the answer is Option A, proximal. Moving to our 14th question, example of dystrophic calcification. Option A, hyperparathyroidism. Option B, sarcoidosis disease. Option C, hypervitaminosis D. Option D, myositis ossificans. And the answer is option D, myositis ossificans. Moving to 15th question. First carpo-metacarpal joint is option A, pivot joint, option B, hinge joint, option C, ball and socket joint, option D, saddle joint, and the answer is option D, saddle joint. Moving to our 16th question, Gower sign is seen in option A, herpes zoster, option B, sciatic nerve palsy, option C, Marfan syndrome, option D, Duchenne's muscular dystrophy, and the answer is option D, Duchenne's muscular dystrophy. Moving to our 17th question, angle dorsiflexion and plantarflexion take place in dash. Option A, sagittal plane and frontal axis. Option B, frontal plane and sagittal axis. Option C, transverse plane and vertical axis. Option D, coronal plane and horizontal axis. And the answer is option A, sagittal plane and frontal axis. Moving to our 18th question, burst fracture is seen in option A, talus fracture, option B, vertebral fracture, option C, femoral head fracture, option D, scaphoid, and the answer is option B, vertebral fracture. Moving to our 19th question, Cabot, Margaret knot and dorsivores developed. Option A, proprioceptive neuromuscular facilitation, option B, synergic movement pattern, option C, progressive pattern movements, option D, reflex creeping and reflex reaction, and the answer is option A, proprioceptive neuromuscular facilitation. Moving to our 20th question, a patient is unable to taste a piece of sugar cube placed on the anterior part of his tongue. Which cranial nerve is affected? Option A, facial, option B, glossopharyngeal, option C, vagus, option D, hypoglossal, and the answer is option A, facial. Moving to our 21st question, second order lever is a lever of dash. Option A, stability, option B, instability, option C, speed, option D, efficiency, and the answer is option D, efficiency. Moving to our 22nd question, low resistance, high repetition exercise is used to improve muscle dash. Option A, strength, option B, endurance, option C, volume, option D, coordination, and the answer is option B, endurance. Moving to our 23rd question, the advantage of isometric contraction could be because of it. Option A, help for re-education, option B, helps gaining muscle strength, option C, prepare for dynamic exercise, option D, all of the above, and the answer is option D, all of the above. Moving to our 24th question, which muscle is inserted into the floor of intertubercular sulcus of the humerus? Option A, latissimus dorsi, option B, teres major, option C, pectoralis major, option D, deltoid, and the answer is option A, latissimus dorsi. Moving to our 25th question, nutrient artery runs. Option A, towards metaphysis, option B, away from metaphysis, option C, away from epiphysis, option D, none, and the answer is option A, towards metaphysis. Massage and application of balms to painful area in the body relieve the pain due to option A, stimulation of the endogenous analgesic system, option B, release of the endorphin by the first order neurons in the brainstem, option C, release of glutamate and substance B in the spinal cord, option D, inhibition by large myelinated afferent fibers, and the answer is Option D. Inhibition by large myelinated afferent fibers. Now let's move to our 27th question. Which is the important factor to gain bone density? Option A. Resistance training. Option B. Weight bearing aerobic conditioning. Option C. Weight bearing resistance training. Option D. Non-weight bearing aerobic training. And the answer is Option C. Weight bearing resistance training. Now let's move to our 28th question. Pulse pressure or PP is considered the dash. Option A. Difference between the systolic and diastolic pressure. Option B. The sum of the systolic and diastolic pressure. Option C. The inverse of the blood pressure. Option D. Half of the systolic pressure. And the answer is Option A. Difference between the systolic and the diastolic pressure. Moving to our 29th question. Multiple sclerosis is a disease that attacks the dash of the neurons in the CNS. Option A. Myelin sheath. Option B. Axon terminals. Option C. Sodium canals. Option D. Nicotinic receptors. And the answer is Option A. Myelin sheaths. Moving to our 30th question. Russian current is Option A. Low frequency. Option B. Medium frequency. Option C. High frequency. Option D. None of the above. And the answer is Option B. Medium frequency. Moving to our 31st question. Sprinkle's shoulder is due to the deformity. Option A. Scapula. Option B. Humerus. Option C. Clavicle. Option D. Vertebra. And the answer is Option A. Scapula. Moving to our 32nd question. Antibody in chronic allergy. Option A. IgM. Option B. IgA. Option C. IgG. Option D. IgE. And the answer is Option D. IgE. Moving to our 33rd question. Which of the following vitamin is not stored in the liver? Option A. Vitamin A. Option B. Vitamin B. Option C. Vitamin C. Option D. Vitamin D. And the answer is Option C. Vitamin C. Moving to our 34th question. Difference in murmurs of PDA and ASD is R. Option A. Delayed P2 in PDA. Option B. Wide split of S2 in PDA. Option C. Ostentation of S1 in ASD. Option D. Continuous murmur in PDA. And the answer is Option D. Continuous murmur in PDA. Moving to our 35th question. The hydrocollateral packs are heated up to dash temperature. Option A. 50 degree to 60 degree Celsius. Option B. 75 degree to 80 degree Celsius. Option C. 80 degree to 50 degree Celsius. Option D. None of the above. And the answer is Option B. 75 degree to 80 degree Celsius. Moving to 36th question. Transpulmonary pressure is the difference between Option A. The bronchus and atmospheric pressure. Option B. Pressure in the alveoli and intrapleural pressure. Option C. Atmosphere and intrapleural pressure. Option D. Atmosphere and intraalveolar pressure. And the answer is Option B. Pressure in the alveoli and intrapleural pressure. Moving to our 37th question. Plaster of Paris is Option A. Hemihydrated calcium sulfide. Option B. Hemihydrated calcium carbonate. Option C. Hemihydrated calcium bicarbonate. Option D. None of the above. And the answer is Option A. Hemihydrated calcium sulfide. Moving to our 38th question. Root of spine of scapula corresponds to dash. Option A. T2. Option B. T3. Option C. T5. Option D. T7. And the answer is Option B. T3. Moving to our 39th question. Dash manipulation is used to obtain sensory stimulation. Option A, stroking. Option B, effleurage. Option C, kneading. Option D, friction. And the answer is option A, stroking. Moving to our 40th question. A pillow is placed under the abdomen in prone lying position for massage of the back to dash. Option A, flatten back. Option B, raise the pelvis to facilitate drainage. Option C, relieve pressure of the breast in case of females. Option D, all of the above. And the answer is option D, all of the above. Moving to our 41st question. Lumbar plexus present in option A, anterior part of the psoas muscle. Option B, anterior part of the quadratus lumborum. Option C, posterior part of the psoas muscle. Option D, posterior part of quadratus lumborum. And the answer is option C, posterior part of the psoas muscle. Moving to our 42nd question. Which of the following spinal dermatome level corresponds with the landmark of inguinal ligament? Option A, T10. Option B, L1. Option C, L3. Option D, L5. And the answer is option B, L1. Moving to our 43rd question. Which of the following eye muscle rotate the eye downward and away from the midline? Option A, inferior oblique. Option B, superior oblique. Option C, inferior rectus. Option D, superior rectus. And the answer is option B, superior oblique. Moving to our 44th question. In which fracture garden spade deformity is seen? Option A, Cole's fracture. Option E, Bennett's fracture. Option C, Barton's fracture. Option D, Smith's fracture. And the answer is option D, Smith's fracture. Moving to our 45th question. Jerky and sudden random movements are often associated with dash lesion. Option A, midbrain. Option B, basal ganglia. Option C, subthalamic. Option D, thalamus. And the answer is option B, basal ganglia. Moving to our 46th question. Dash current is used for stimulation of innervated muscle. Option A, Faraday. Option B, Faraday type. Option C, surge Faraday. Option D, interrupted galvanic. And the answer is option C, surge Faraday. Moving to our 47th question. In SWD, most uniform field in the tissue is given by option A, narrow spacing. Option B, wide spacing. Option C, medium spacing. Option D, even spacing. And the answer is option C, medium spacing. Moving to our 48th question. Weakness in which makes it extremely difficult to ambulate on crutches. Option A, medial deltoid. Option B, rater spinae. Option C, latissimus dorsi. Option D, rhomboid. And the answer is option C, latissimus dorsi. Moving to our 49th question. Tendon passing below the sustentaculum thalli is option A, flexor hallucis longus. Option B, flexor digitorum longus. Option D, tibialis posterior. Option D, peroneus brevis. And the answer is option A, flexor hallucis longus. Moving to our 50th question. Closure of the aortic valve occurs at the onset of which phase of the cardiac cycle? Option A, isovolumetric contraction. Option B, rapid ejection. Option C, pre-diastole. Option D, isovolumetric relaxation. And the answer is option D, isovolumetric relaxation. Which type of gait pattern would be most appropriate for patients who exhibit unilateral lower extremity weakness? Option A 4-point gait, option B 2-point gait, option C 3-point gait, option D swing through. And the answer is option C 3-point gait. Moving to our 52nd question. A uniform resistance at all points of range during relaxed passive movement is known as dash spasticity. Option A clasp nerve, option B lead pipe, option C cog wheel, option D all of the above. And the answer is option B lead pipe. Moving to our 53rd question. Deep tendon reflex is exaggerated in lesion. Option A upper motor neuron, option B lower motor neuron, option C peripheral nerve injury, option D none of the above. And the answer is option A upper motor neuron. Moving to our 54th question. Duga's test is diagnostic of option A anterior dislocation of the shoulder, option B scaphoid fracture, option C fracture of neck or femur, option D dislocation of hip. And the answer is option A anterior dislocation of the shoulder. Moving to our 55th question. The crystal deposited in the joint in gouty arthritis is option A calcium pyrophosphate, option B calcium oxalate, option C monosodium urate crystals, option D disodium urate. And the answer is option C monosodium urate crystals. Moving to our 56th question. Knee flexion in prone lying is an example of dash. Option A first order lever, option B second order lever, option C third order lever. And the answer is option C third order lever. Moving to a 57th question. Muscle is most efficient in dash range. Option A outer, option B outer part of the middle, option C inner, option D inner part of the middle. And the answer is option B outer part of the middle. Moving to our 58th question. Name the intercapsular knee ligament of knee joint. Option A tibial collateral ligament, option B anterior cruciate ligament, option C fibular collateral ligament, option D ligamentum patellae. And the answer is option B anterior cruciate ligament. Moving to our 59th question. Crude maneuver is when there is option A automatic bladder, option B autonomous bladder, option C detrusor sprinter, option D flaccid sphincter and spastic detrusor. And the answer is option B autonomous bladder. Moving to our 60th question. Teddy Thomas sign is related with option A scapholunate dislocation, option B perilunate dislocation, option C perilunate dislocation with associated tricuteral dislocation with carpal, option D lunate dislocation. And the answer is option A scapholunate dislocation. Moving to our 61st question. ETOIMS stands for option A electrical treatment option for intramuscular stimulation, option B electrical twitch obtaining intramuscular stimulation, option C electrical twitch observed on intramuscular stimulation, option D none of the above. And the answer is option B electrical twitch obtaining intramuscular stimulation. Moving to our 62nd question. Rule of 9 is used in assessing option A area of burns, option B severity of psoriasis, option C scoring brain injury, option D weakness in the spine injury. And the answer is option A area of burns. Moving to our 63rd question. Rheobase is option A maximum tolerable current for a nerve impulse at long duration, option B minimum current for nerve impulse at short duration, option C minimum current for nerve impulse at long duration, option D none of the above. And the answer is Option C, minimum current for nerve impulse at long duration. Moving to our 64th question, ASIA grading is used in option A, traumatic brain injury, option B, traumatic spinal cord injury, option C, traumatic hip injury, option D, traumatic shoulder injury, and the answer is option B, traumatic spinal cord injury. Moving to our 65th question, the upper and middle trunk of the brachial plexus combine to form the dash chord. Option A, lateral, option B, posterior, option C, medial, option D, anterior, and the answer is option A, lateral. Moving to our 66th question, the unit of ultrasound is option A, watts, option B, watts per centimeter square, option C, volt square inch, option D, Newton, and the answer is option B, watts per centimeter square. Moving to our 67th question, angle of Loeys corresponds to option A, T2 to T3 spine, option B, T4 to T5 spine, option C, T6 to T7 spine, option D, none of this, and the answer is option B, T4 to T5 spine. Moving to our 68th question, mostly UVR is absorbed in option A, epidermis, option B, dermis, option C, subcutaneous tissue, option D, capillary loop, and the answer is option A, epidermis. Moving to our 69th question, excessive formation of substance or secretion in the body is controlled in order to maintain hemostasis by option A, positive feedback mechanism, option B, negative feedback mechanism, option C, osmosis, option D, hemodynamics, and the answer is option B, negative feedback mechanism. Moving to our 70th question, depolarization of ventricles begins from option A, posterior lateral area of the left ventricle, option B, base of the left ventricle, option C, left part of the septum, option D, right part of the septum, and the answer is option C, left part of the septum. Moving to our 71st question, Fromen's test is done for dash. Option A, intrinsic muscle, option B, abductor pollicis brevis, option C, adductor pollicis brevis, option D, opponent's pollicis, and the answer is option C, adductor pollicis. Moving to our 72nd question, groove below the cuboid bone is for the tendon of option A, tibialis anterior, option B, tibialis posterior, option C, peroneus longus, option D, peroneus brevis, and the answer is option C, peroneus longus. Moving to our 73rd question, intercalated disc is present in option A, smooth muscle, option B, skeletal muscle, option C, cardiac muscle, option D, none of the above, and the answer is option C, cardiac muscle. Moving to our 74th question, for a patient having foot drop, the orthosis recommended is option A, knee angle foot orthosis, option B, hip knee angle foot orthosis, option C, hip or foot orthosis, option D, angle foot orthosis, and the answer is option D, angle foot orthosis. Moving to our 75th question, composite bone matrix strength is due to option A, phosphate, option B, calcium hydroxypeptidate, option C, osteocalin, option D, collagen, and the answer is option B, calcium hydroxypeptidate. Burroughs test and Ottoloni test is useful in option A, instability and dislocation of the shoulder joint, option B, instability and dislocation of the hip joint, option C, instability of knee joint, option D, fracture of the knee joint, and the answer is option B, instability and dislocation of the hip joint. Moving to our 77th question, UCBL, University of California, Berkeley Lab, insert is indicated for dash. Option A, equinus foot. Option B, cavus foot. Option C, flat foot. Option D, CTEV foot. And the answer is option C, flat foot. Moving to our 78th question. Galassi fracture is option A, supracondylar fracture of the humerus. Option B, fracture of the distal radius with inferior radioulnar joint dislocation. Option C, fracture of in proximal site and dislocation of the elbow. Option D, fracture of the radial head. And the answer is option B, fracture of the distal radius with inferior radioulnar joint dislocation. Moving to our 79th question. Measurement of axillary crutches is taken from dash. Option A, anterior axillary fold to 20 cm forward and lateral to little toe. Option B, tip of the axilla to 20 cm forward and lateral to little toe. Option C, anterior axillary fold to tip of medial malleolus. Option D, all of the above. And the answer is option B, tip of the axilla to 20 cm forward and lateral to the little toe. Moving to our 80th question. A patient coming to you finds it difficult to flex and extend his spine. His chest expansion is also reduced. What is the most plausible condition? Option A, gouty arthritis. Option B, rheumatoid arthritis. Option C, systematic lupus erythematosus. Option D, ankylosing spondylitis. And the answer is option B, ankylosing spondylitis. Moving to our 81st question. Saturday night palsy is option A, ulnar nerve palsy. Option B, radial nerve palsy. Option C, axillary nerve palsy. Option D, medial nerve palsy. And the answer is option B, radial nerve palsy. Moving to our 82nd question. Which muscle is known as kicking muscle, which is a two-joint muscle that is active during both hip flexion and knee extension? Option A, iliopsoas. Option B, rectus femoris. Option C, sartorius. Option D, pectineus. And the answer is option B, rectus femoris. Moving to our 83rd question. In 2-point discrimination, the distance between 2 points in the palm is option A, 5 to 6 mm. Option B, 7 to 10 mm. Option C, 10 to 15 mm. Option D, none. And the answer is option B, 7 to 10 mm. Moving to our 84th question. Fixed stiffness of first IP joint of big toe is called option A, hallucis varus. Option B, hallucis valgus. Option C, hammer toe. Option D, hallucis rigidus. And the answer is option B, hallucis rigidus. Moving to our 85th question. What should be the progression of exercise protocol following a musculoskeletal injury? Option A, isometric, eccentric, concentric. Option B, isometric, concentric and eccentric. Option D, isometric, concentric, eccentric. And answer is option A, isometric, eccentric and concentric. Moving to our 86th question. Heels are raised to stand on toes is an example of option A, first order lever. Option B, second order lever. Option C, third order lever. And the answer is option B, second order lever. Moving to our 87th question. Relaxed passive movement is useful for dash. Option A, muscle strengthening. Option B, improving joint range of muscle. Option C, remembrance of pattern of movement. Option D, improving coordination. And the answer is option C, remembrance of the pattern of movement. Moving to our 88th question. Cavitation is option A, thermal effect of ultrasound. Option B, non-thermal effect of ultrasound. Option D, all of the above. Option D, none of the above. And the answer is option B, non-thermal effect of ultrasound. Moving to our 89th question, during tonsillitis, pain in the ear is due to the involvement of option A, vagus nerve, option B, coda tympani nerve, option C, glossopharyngeal nerve, option D, hypoglossal nerve, and the answer is option C, glossopharyngeal nerve. Moving to our 90th question, prolonged walking or running in those who are not accustomed to it can cause fracture of option A, talus, option B, calcaneum, option C, metatarsal shaft, option D, phalanges, and the answer is option C, metatarsal shaft. Moving to our 91st question, the band which disappears in muscle contraction is option A band, option B I band, option C Z band, option D H zone, and the answer is option D H zone or H band. Moving to our 92nd question, which is dependent on velocity. Option A flaccidity, option B spasticity, option C rigidity, option D none of the above, and the answer is option B spasticity. Moving to our 93rd question, persons with unilateral hip problem lean to the affected side and advised to use a walking stick. On which side he should use the stick? Option A affected side, option B sounded side, option C either side, option D single stick is not useful, and the answer is option B sounded side. Moving to our 94th question, a person with BMI greater than 25 kg per meter square is option A overweighted, option B underweighted, option C under obese, option D obese, and the answer is option D obese. Moving to our 95th question, electromyography. Option A records skeletal muscle action potential, option B record muscle twitch, option C measures the electrical activity of the heart muscle, option D measures the neuronal action potentials, and the answer is option D measures the neuronal action potentials. Moving to our 96th question, lumbar spine is not involved in dash. Option A ankylosing spondylitis, option B rheumatoid arthritis, option C osteoarthritis, option D none of the above, and the answer is option B rheumatoid arthritis. Moving to our 97th question, the nutrient artery to the femur is option A profunda femoris artery, option B femoral artery, option C popliteal artery, option D medial circumflex femoral artery, and the answer is option A profunda femoris artery. Moving to our 98th question, head of the humerus measures almost half of the sphere with an angular value dash. Option A 180, option B 160, option C 150, option D 120, and the answer is option C 150. Moving to our 99th question, joint mobilization is contraindicated in option A soft tissue tightness, option B joint stiffness, option C loose body inside the joint, option D bursitis, and the answer is option C loose body inside the joint. Moving to our 100th question, pulmonary edema is most likely associated with a failing dash. Option A right atrium, option B left atrium, option C right ventricle, option D left ventricle, and the answer is option D left ventricle. 1. For runners, a reduction of impact peak load can be achieved by option A forefoot striking, option B using suitable running shoe, option C reducing weight, option D all of the above, and the answer is option D all of the above. Moving to our question number 102, dash splint is prescribed for a case of median nerve injury. Option A Cook-up splint, option B knuckle bender, option C pancake, option D short opponents, and the answer is Option D, short opponents. Moving to question number 103. Pain sensation is carried by option A, medial spinothalamic tract, option B, lateral spinothalamic tract, option C, posterior column, option D, anterior column, and the answer is option B, lateral spinothalamic tract. Moving to our question number 104. Which of the following spinal orthosis control lumbar sacral flexion extension? Option A, Tyler, option B, Knight, option C, Harris, option D, Tyler and Knight, and the answer is option C, Harris. Moving to question number 105. Which feature is shared by cardiac muscle cells and skeletal muscle cell? Option A, striation, option B, intercalated disc, option C, branching, option D, involuntary nature, and the answer is option A, striations. Moving to question number 106. The respiratory center is located in the dash and the dash. Option A, midbrain and pons. Option B, pons and medulla oblongata. Option C, midbrain and medulla oblongata. Option D, pons and hypothalamus. And the answer is option B, pons and medulla oblongata. Moving to question number 107. Changes in sensory aphasia are often associated with a dash lesion. Option A, frontal lobe, option B, parietal lobe, option C, Broca's area, option C, Wernicke's area, and the answer is option D, Wernicke's area. Moving to our question number 108. Kinney-Brooks disease affects option A, scaphoid, option B, lunate, option C, tricutrium, option D, trapezoid, and the answer is option B, lunate. Moving to our question number 109. The technique to stretch adhesion in a muscle is called option A, Faradism under pressure, option B, Faradic foot bath, option C, Faradism under tension, option D, none of the above, and the answer is option C, Faradism under tension. Now let's move to our question number 110. In which lever effort is between the fulcrum and the weight? Option A, first order lever, option B, second order lever, option C, third order lever, and the answer is option C, third order lever. Now let's move to our question number 111. In blood clotting, what activates factor 10? Option A, prothrombase, option B, thrombin, option C, the extrinsic pathway, option D, tissue plasmogen activator, and the answer is option A, prothrombinase. Now let's move to our question number 112. Pes ansias include dash. Option A, semimembranosis, gracilis and sartorius. Option B, semimembranosis, rectus femoris and ITB. Option C, semitendinosis, gracilis and sartorius. Option D, semitendinosis, pectineus and adductor magnus, and the answer is option C, semitendinosis, gracilis and sartorius. Now let's move to our question number 113. Hold, relax, contract is a part of dynamic stretching. Option A, PNF stretching, option B, ballistic stretching, option C, passive stretching, and the answer is option A, PNF stretching. Moving to question number 114. Typical tennis elbow involves the common extensor muscle. Which muscle is commonly involved? Option A, extensor carpi radialis longus, option B, extensor carpi radialis brevis, option C, brachioradialis, option D, extensor indicis, and the answer is option B, extensor carpi radialis brevis. Moving to question number 115. Swan neck deformity is due to dash. Option A, contracture of extensor digitorum communicis. Option B, intrinsic tightness. Option C, contracture of FDP, that's flexor digitorum profundus. Option D, rupture, laxasis of volar plate. And the answer is Option D. Rupture or laxity of volar plate. Let's move to our question number 116. Potentile deformity is due to dash. Option E. Contracture of FDS, that's flexor digitorum superficialis. Option B. Rupture of central slip of extensor expansion. Option C. Contracture of extensor digitorum. Option D. Rupture of the collateral slip of extensor expansion. And the answer is option B. Rupture of the central slip of extensor expansion. Now let's move to our question number 117. The QRS complex in a standard ECG represents option A. Depolarization of auricle. Option B. Depolarization of ventricle. Option C. Repolarization of ventricle. Option D. Repolarization of auricles. And the answer is option B. Depolarization of ventricles. Now let's move to our question number 118. In amputation, myopathy is done primarily to option A. Allow and bearing on the stem. Option B. Produce best cosmetic appearance. Option C. Restore resting length of the muscle and improve circulation. Option D. Improve prosthetic fitting. And the answer is option A. Allow and bearing on the stem. Now let's move to our question number 119. The cells that are found in the tendon are called option A. Osteocytes. Option B. Adipocytes. Option C. Hemiocytoblasts. Option D. Fibroblasts. And the answer is option D. Fibroblast. Now let's move to our question number 120. Sprain is an injury to option A ligament or a joint capsule without dislocation. Option B. A joint with dislocation. Option C. A ligament or joint capsule with or without dislocation. Option D. Muscle, ligament or bone. And the answer is option A. A ligament or joint capsule without dislocation. Let's move to question number 121. Dobbin sign is likely to be diagnosed as a case of option A. Bicipital tendinitis. Option B. Axillary nerve neurotisis. Option C. Subacromial bursitis. Option D. Deltoid bursitis. And the answer is option C. Subacromial bursitis. Now let's move to our question number 122. Supporting cells located within the CNS are collectively called dash. Option A. Neuroglia. Option B. Astrocytes. Option C. Pericranion. Option D. Satellite cells. And the answer is option A. Neuroglia. Now let's move to question number 123. Meniscal injury is identified by special test. Option A. Anterior Droyer's test. Option B. Lichman's test. Option D. Apley's test. Option D. Oberer test. And the answer is option C. Apley's test. Now let's move to question number 124. When listening to left dub sound on the heart with a stethoscope, what is the cause of dub sound? Option A. The blood flowing through the open semilunar valves. Option B. The blood flowing through the open atrioventricular valves. Option C. The turbulent blood flow through closing atrioventricular valves. Option D. The turbulent blood flow through closing semilunar valves. And the answer is option D. The turbulent blood flow through the closing semilunar valves. Now let's move to our question number 125. Ability to interrupt letter written on the palmar surface of one's hand is option A. Stereogenesia. Option B. Aphilogenesia. Option D. Graphesthesia. Option D. None. And the answer is option C. Graphesthesia. In pulled elbow syndrome, there is a dislocation of option A. Radiohumeral joint. Option B. Radioulnar joint. Option C. Humeroulnar joint. Option D. All of the above. And the answer is option B. Radioulnar joint. Now let's move to question number 127. Locking of knee joint can be caused by option A. Osgood shelter. Option B, loose bodies in knee joint. Option D, tuberculosis of knee. Option D, A and B both. And the answer is option D, A and B both. Now let's move to question number 128. Deltoid ligament is attached to all except option A, medial malleolus, option B, medial cruciform, option C, spring ligament, option D, sustainiculum tali. And the answer is option B, medial cruciform. Now let's move to question number 129. Presence of which of the following condition in urine are indicative of diabetes mellitus? Option A, uremia and renal calculi. Option B, ketosuria and glucosuria. Option C, renal calculi and hyperglycemia. Option D, uremia and ketonuria. And the answer is option B, ketosuria and glucosuria. Now let's move to question number 130. Crossed hemiplegia means dash. Option A, lesion above pontine. Option B, at the level of pontine. Option C, below pontine. Option D, none of the above. And the answer is option B, at the level of pontine. Now let's move to question number 131. Site of injection in gluteus. Option A, inferior medial. Option B, superior medial. Option C, superior lateral. Option D, inferior lateral. And the answer is option C, superior lateral. Moving to question number 132. In rehydration therapy, ORS used means option A, oxygen replacement therapy. Option B, oxygenated respiratory solution. Option C, oral rehydration solution. Option D, optimal recovery state. And the answer is option C, oral rehydration solution. Moving to question number 133. External rotation of glenohumeral joint is checked by option A, medial glenohumeral ligament. Option B, inferior glenohumeral ligament. Option C, anterior coracohumeral ligament. Option D, posterior coracohumeral ligament. And the answer is option A, medial glenohumeral ligament. Moving to question number 134. Usually the direction of elbow dislocation is dash. Option A, backward. Option B, backward and lateral. Option C, backward and medial. Option D, forward. And the answer is option B, backward and lateral. Moving to question number 135. An S3 heart sound is often associated with option A, CHF, congestive heart failure. Option B, COPD, chronic obstructive pulmonary disease. Option C, atrial fibrillation. Option D, ventricular fibrillation. And the answer is option A, CHF or congestive heart failure. Moving to question number 136. Osteochondritis of epiphysis of femoral head is known as option A, kidney box disease. Option E, Purse disease. Option C, Clash disease. Option D, Planner's disease. And the answer is option B, Purse disease. Moving to question number 137. The name of the coil used to produce Faraday current in the past was option A, Koch coil. Option B, Smart Bristow's Faraday coil. Option C, induction coil. Option D, none of the above. And the answer is option B, Smart Bristow's Faraday coil. Moving to question number 138. Which of the following enzyme breaks down the starch to maltose? Option A, amylase. Option D, lipase. Option C, trypsinogen. Option D, pepsin. And the answer is option A, amylase. Now let's move to question number 139. For meniscus injury, there should be option A, shear of compressed knee. Option B, torsion of the compressed knee. Option C, shear and torsion of the knee. Option D, torsion of extended knee. And the answer is option B, torsion of the compressed knee. Now let's move to question number 140. When is the first polio drop is given? Option A, soon after birth. Option B, after 15 days of birth. Option C, 7th day of the birth. Option D, 6th month of the birth. And the answer is option A, soon after birth. Now let's move to question number 141. Inversion-eversion component is more in option A, ankle joint. Option B, mid-tarsal joint. Option C, subtalar joint. Option D, none of the above. And the answer is option C, subtalar joint. Now let's move to question number 142. Large and possible strong bone is possible. Option A, exercising in adulthood. Option B, exercising in childhood. Option C, exercising after growth phase. Option D, remaining physically active in childhood and adulthood. And the answer is option B, exercising in childhood. Now let's move to question number 143. A person who is standing on both of their feet is stable when option A, their base of support is as wide as is comfortably possible. Option B, their center of gravity is above their base of support. Option C, their center of gravity is close to their base of support. Option D, position of their center of gravity and base of support coincide. And the answer is option A, their base of support is as wide as comfortable possible. Now let's move to question number 144. The ligament that extends from the inferior edge of the ulnar radial nose to insert into the neck of radius is option A, angular ligament. Option B, caudate ligament. Option C, oblique cord. Option D, none of the above. And the answer is option B, caudate ligament. Now let's move to question number 145. Joint reaction force is option A, compressive force in the joint. Option B, compressive force and muscle compressive force. Option C, compressive force and muscle rotatory force. Option D, compressive force of muscle and other soft tissues. And the answer is option B, compressive force and muscle compressive force. Now let's move to question number 146. The radioulnar joint is a diarthroidal uniaxial joint of variety. Option A, saddle joint. Option B, plane joint. Option C, pivot joint. Option D, condyloid joint. And the answer is option C, pivot joint. Now let's move to question number 147. The carpal arch is supported by ligament known as option A, carpal ligament. Option B, flexor retinaculum. Option C, transverse ligament. Option D, none of the above. And the answer is option B, flexor retinaculum. Now let's move to question number 148. Static stabilization of glenohumeral articular surface is provided by option A, coracohumeral ligament. Option B, coracoclavicular ligament. Option C, superior joint capsule. Option D, glenoid labrum and capsulo-ligamentous component. And the answer is option D, glenoid labrum and capsulo-ligamentous component. Now let's move to question number 149. The smooth muscle of the bronchial airway is innervated by which of the following nerves? Option A, intercostal nerve. Option B, phrenic nerve. Option C, thoracic splenic nerves. Option D, vagus nerve. And the answer is option D, vagus nerve. Now let's move to question number 150. The concave convex rule depicts if the bone with convex surface moves on the bone with convexity. The convex joint surface. Option A, move in the opposite direction to the bone segment. Option B, moves in the same direction to the bone segment. Option C, halfway in opposite direction and another halfway in the same direction to the bone segment. Option D, none. And the answer is option A, moves in the opposite direction to the bone segment. That's all for today. If you need further clarification, check the description box and give your feedback in the comment box. If you like this MCQ section, do subscribe to this channel for watching part 7 of this series. Thank you.